Good morning, everyone, and welcome to MyDiabetesHQ Live, a weekly live interactive broadcast on YouTube and Facebook, produced and hosted by Cities Changing Diabetes volunteers in Philadelphia and Houston. So you've been diagnosed with prediabetes. What's next? Today, our expert guests and panelists will discuss prediabetes, the diabetes prevention program, and other actions that you can take to take care of yourself and stay healthy. Thanks for joining us today. Stay tuned for more right after this. Good morning, everyone. The content shared during the MyDiabetesHQ Live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you have regarding your medical condition. So good morning, I'm Susan Cosgrove. I'm the Director of Health Literacy at the Healthcare Improvement Foundation in Philadelphia. And both Houston and Philadelphia are part of Cities Changing Diabetes global network of 25 cities working to improve diabetes prevention, care, and management. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. On today's episode, we're talking about prediabetes and diabetes prevention. We're so excited to have you here with us this morning on Facebook and YouTube, and please drop us a question or comment, and we'll get to as many as we can during our time together this morning. So with that, I'll introduce today's guests and panelists. So we are going to be joined by Marcy Witherspoon, who's a senior training specialist at Health Federation of Philadelphia. Good morning, Marcy.
Good morning, Susan.
Welcome to the show.
It's nice to be here.
And we'll also be joined by Mr. Richard Byrd, who recently completed the diabetes prevention program. Congratulations, Richard. That's a great accomplishment.
Thank you. Thank you very much.
And as always, we're joined by our fantastic MyDiabetesHQ team. This morning we'll be joined by Serena Valentine, CEO of Core Initiatives and Houston's Diabetes Peer Support Initiatives Program Coordinator. Hi, Serena.
Hello, everyone.
Hello.
Hi, Serena.
So, Marcy, before we get to talking about prediabetes, could you tell us a little bit about your organization, the Health Federation of Philadelphia, and what you do?
Sure. The Health Federation of Philadelphia is a public health nonprofit. We have been around since 1983, and we work primarily to develop programming and products that improve access, equity, and quality in terms of physical health and behavioral health to underserved populations in Philadelphia.
That's great. And I know our organizations work closely together. I'm very familiar with the work that you do, and it's really all fantastic work. So thank you. So with that, I want to start by just talking about prediabetes. So, what is prediabetes? If someone's just been diagnosed with prediabetes, what do they need to know about that condition?
Okay, so prediabetes is a condition whereby one's blood sugar is higher than normal, but not high enough where there's a type 2 diabetes diagnosis. So typically, if you have prediabetes, your fasting blood sugar is between 100 and 125, or your hemoglobin A1C is between 5.7 and 6.4%. So it's before you've have a diagnosis of type 2 diabetes and your blood sugar is higher, and you may be having signs and symptoms that are the ones on the screen, but you may not be. You may get no signs and symptoms at all, and this is why so many people are walking around with prediabetes and are not even aware of it. The statistics that we have are that 1 out of every 3 people in the United States has prediabetes, and that 9 out of 10 of those people don't even know that. They're not even aware of that. They may not pay attention to the symptoms that you had on the screen, the frequent urination, maybe blurred vision, maybe increased thirst and hunger, maybe fatigue, because those can seem like very common symptoms for many other things, and we tend to rationalize some of those symptoms and make excuses for them. Think, well, maybe we just had something a little salty, so we're a little thirsty, or I'm a little more tired than usual, but I probably didn't sleep well last night, or we oftentimes have excuses for them and we don't pay attention to them.
Yeah, I think that's really important to note that, those symptoms can appear. You can also have prediabetes and not really know it and not have those symptoms. And Serena, I think that you shared with us before that looking back, you kind of had a sense that you could reflect back and see that maybe you had had some of those symptoms prior to being diagnosed with type 2 diabetes yourself.
Yes, I had no idea that I was even dealing with diabetes at the time. I had the blurred vision. I was sleepy all the time, unexplained weight loss. All of that was going on, but I had no idea until I had to go to the ER because I had a severe kidney infection and my blood sugar was 555. So that's when I got diagnosed with diabetes. And at that time, I had not even heard of the term prediabetes at all.
Mm-hmm. Yeah, and I think it's important to note that, a prediabetes diagnosis, I think it can be scary, but really want to get what we want to talk about and get to today is that can be a diagnosis that can really empower you to take action, to take care of your health, to do something like enroll in a diabetes prevention program. So any other, risk factors, Marcy, that you want to highlight that people should be aware of in addition to kind of maybe looking out for those symptoms?
Sure. So one risk factor is one's lifestyle. So it could be somebody who has a sedentary lifestyle and that has limited physical activity. It could be somebody who has unhealthy eating habits. It could be anybody who is really 45 or older is at risk, although the age is coming down because of the obesity epidemic in this country. It could be anybody who is overweight or obese, as described in the BMI, body mass index chart. It could be somebody that has family history. So generally speaking, a parent or sibling. It could be somebody it's particularly an issue for communities of color. So higher rates with African American, Hispanic American, Asian American, and Native American communities. Which is why one of the reasons why Philadelphia is really working very, very diligently to try to address this epidemic, because it's really impacting many, many communities in our city. And it is also an issue for people who have previously had gestational diabetes, so women who were diagnosed with diabetes during their pregnancy.
Thanks, Marcy. Yeah, I think that's helpful for people to understand, again, those symptoms, the potential risk factors. And so with that, I want to talk about kind of what action someone can take once they've been diagnosed with prediabetes. So, what can someone do to prevent the prediabetes from progressing into diabetes?
Well, there's a lot that's within our control to do. So I mentioned, we can't control the genetic components of our lives, but we can control our lifestyle. So there are some modest lifestyle changes that can be made in order to address the fact that a pre-diabetic has insulin that his or her body has but is not maybe either working effectively or doesn't have enough insulin. And so we know that incremental changes in weight, 5 to 7% typically for the diabetes prevention program, a modest loss of weight has been shown to decrease the risk of developing type 2. And this information was learned from the diabetes prevention program research study, which determined that you don't have to lose lots of weight, but incremental, small, modest losses that are sustainable, that can be part of your lifestyle, not that you're on a diet and that you have to eat a certain way and then, afterwards I can go back to the way I ate. But a lifestyle changes with your food can make all the difference. And then the other significant difference is in increasing the physical activity. And again, it doesn't have to be that you work out at a gym. It just means that you have to have moderate physical activity that you incorporate into your week or into your day in order to help your body start using the insulin that it does have more efficiently, and all the other benefits of physical activity that we know. So these are the two goals of the DPP: a loss of 5 to 7% of the starting weight when you start the program, and 150 minutes. So basically about 30 minutes a day for 5 days a week, but it can be spread out however it works.
Mm-hmm. And just to give people a sense of the weight loss goals too, like when you say a modest amount of weight, you had 5 to 7%. So if somebody weighs 200 pounds, that's like 10 to 15 pounds. I think if you weigh 300 pounds, that's like 15 to 20 pounds. So it really can be a pretty modest loss in weight, and you can still see those great gains. And so we're going to get into talking about the specifics about like what the DPP program is. But before we do that, Richard, I'd love to hear from you about some of the lifestyle changes that you've been able to make, and kind of what spurred you to take action and to make some of those changes.
PCP, my personal physician, recommended that I take the DPP program because the metabolic panel that was taken showed the A1C hemoglobin at 6.2%, and apparently right now I'm down to 5.7 with the help with the DPP program. Initially, I think it was my two risk factors are age and race, and the third one was my eating habits, which I was introduced to at a younger age. And who could go without growing up on McDonald's? That'll never go away. Once I've learned that I had the pre-diabetic symptoms, I joined the DPP program with Marcy Witherspoon, and from then I had to integrate my eating habits. I had to change my eating habits and exercise. Before that, I did always love to walk, and that was the majority of my exercise at my age. Prior to that, I used to ride a bicycle, but I had to give that up for a while. I fell one time. But I also have a medical problem, and that is with a congestive heart failure, and I had to integrate the eating habits and the physical activity with the DPP program, and that was my major challenge. Mm-hmm. I don't know what else I could tell you other than that it works. If you concentrate and use discipline and follow the instructions and the booklet, you can accomplish that goal of preventing diabetes.
That's great, Richard. Thank you for sharing. And I know, it takes a lot to commit to a program. And again, just congratulations on recently kind of completing it. That's a huge accomplishment. Yes, applause.
16 weeks.
16 weeks. So that's a great note to kind of transition to, Marcy, if you could talk a little bit about exactly what the DPP is. You mentioned specifically that there have been research studies that have been done that have really demonstrated that it works. What is it? What does it look like? How long is it? What should someone expect if they are enrolling in the DPP?
So it's actually a year-long program, and there are 16. The phase 1. Core sessions are weekly sessions, and then phase 2 are monthly or bi-monthly sessions, and they focus on healthy eating. The DPP is neither prescriptive or restrictive, so it does not tell you what you should eat or what you should not eat. The hope is that you can modify what you're eating and prepare it either in a more healthy way, use a different kind, eat healthy fats, broil rather than fry, and just either prepare the food differently or eat less of it, really watch portions so you're not engaged in portion distortion, and really pay attention to what you're putting in your body, really noticing. So the other part of your question was so what to expect. So each week, the coach, the lifestyle coach, is supposed to facilitate discussion and engagement with the group around a specific topic. And the purpose is to recognize that our eating habits took a long time to develop, and it's going to take a long time to undo some of the habits. And that, it may have taken us 30 or 40 or 50 years of eating a certain way, and then change does not happen overnight. That change doesn't happen when you feel judged or blamed or shamed. Change happens in the context of relationships, and it happens when you feel supported, and when you feel encouraged, and when you feel motivated. And the group actually develops a tremendous amount of camaraderie if you're facilitating it and you can engage everybody. And as Richard says, the program actually works. And I think the fact that people receive support and look at their health in a different way can be very transformative.
Yeah, thanks, Marcy. And Richard, could you talk a little bit about how you interacted with the group, and how having the group, like in addition to having like the expert lifestyle coach like Marcy who's guiding you along this journey, how did the group really help you along?
Well, it started out with about 24 members, and what I call the last of the Mohegans. It's about 6 or 8 of us right now that really stuck with the program. We all got to know each other, telephone numbers, where we lived, our personal backgrounds, and we all gave each other support during the entire 16 weeks. There was a lot of joy, laughter, camaraderie. It's just getting involved with each other, and taking a proactive role with your health.
Yeah, and Serena, I know you obviously have a lot of experience with like that peer support component too, and I'm sure that you see that too, with the diabetes, management and self-management that you're working on.
Oh yeah, for sure. It's a wonderful experience when it doesn't feel like someone's talking at you or shaming you, as Marcy mentioned earlier. That's not going to make someone change. You can shame someone till the end of time, but if they don't feel like they can do it, then the change is not going to happen. Yeah,
that's great. And I think, Richard, you mentioned like your class started with 24 people, now it's down to like 6 to 8 that really were able to complete it. And I think, we know that this is fairly common with the DPP, is that you'll have a lot more people start it, than are able to complete it. So, Marcy and Richard, any messages for folks that maybe have started the DPP and couldn't quite make it work, like any messages of encouragement or kind of tips for how maybe they could make it work for them in the future?
Well, one is to include in your life progress is don't quit. That's the only thing I can tell you, is don't quit. If you start out on something that you desire, stick with it, and you look at the benefits. I always tell my children, if the side effects is less than the benefit, then take the medicine.
From my perspective, I have often say to the group, and Richard will know this, that I ask folks to look for their why. Why are you doing this? Look inside, and that may be different for everybody, but find your why, find the reason why this is important to you, and And if it's a strong enough reason, then you can take what might seem impossible and make it possible.
Yeah, that's great, Marcy. So finding that why, finding support, I think too. Richard, you said don't quit. I think if you fall down, get up and try again, right? And so, what other supports did you have? Do you have friends and family members and other folks outside of the group that really supported you in this journey?
Well, my daughter is my major person that watches over me. She's my second heart prior to the one I have here. She always wants to make sure that I'm okay, and my children and my grandchildren can experience a father and a grandparent, which I didn't have a grandparent. I had them, but I never experienced that pleasure. Health-wise, I take a proactive role. I constantly check my health with my Temple University Hospital or my specialists. I have several specialists, and Marcy is one, another. So I try to just take a proactive role in your health. It's so important to try to live as long as you can, and the world will benefit through that. The world will benefit through your progress.
Yeah, that's really wonderful, Richard. And it's great to hear that you have such support, and also to think about your daughter and your grandchildren, not only as support to you, but also as your why, as Marcy was saying, like this is why you're doing this too. So you can be there for them and be in good health and live a long, healthy life. So you can kind of be there for them for as long as you can. So that's great. Go ahead, Marcy.
Can I add that? Yeah. One thing I noticed about the group that is actually, there may have been a misunderstanding. We actually finish on Tuesday, so Richard is just about to graduate. But the group has described themselves as kind of each other's family, like like their new family. Particularly folks who don't have other or huge support network, so they may be more isolated than others. And what I have noticed in the group is that people have done for each other in ways that are pretty amazing. Like Richard donated a turkey for the holiday and raffled it off to the group. And another one of our participants is making masks for everybody. And we have another participant who brought bags of apples and oranges during the holiday. He said, because this was a family tradition in his family, and now we were all part of his new family. And Richard, I had introduced the group to Honeycrisp apples, and the following week, Richard had brought the group, everybody had their own Honeycrisp apple. I mean, the group has connected with each other in a way that's pretty awesome to watch. And I think that level of engagement has contributed tremendously to their success.
Yeah, I'm sure that it has. And Marcy, you brought up, specifically like a group member making masks for the other group members. Like, have you seen the group support playing a different role, like in the COVID era versus DPP delivered kind of before this?
Well, there is nothing that can substitute for in-person, face-to-face contact. We know something magical happens when we are in person and we can look each other in the eyes, not through a screen. And we had actually finished our phase 1, all the core sessions, when the stay-at-home orders occurred in March. And our first, and I called everybody in the group. So we have actually 8 people currently that are in the phase 2 process. And I called everybody and told them, I said, we're gonna keep at it, because people have made so much progress. I didn't want to stop the program. It was just too important, and I thought people really needed to stay engaged. And so we try to address all of the potential obstacles in terms of technology and in terms of, people's social and economic determinants of how their environments impacted their health, how the stay-at-home order was going to impact their ability to incorporate physical activity into their lives. We tried to address any number of issues. We started to have deliveries of fresh food on a weekly basis to families' homes. We really tried to, when there was some skepticism, frankly, about whether we could continue the group, we said, no, we're going to try it. We'll work it out. We'll have patience and grace with each other. And as Richard knows, we spend sometimes, the first 10 minutes of each of our groups just working out all the technological glitches, and then we move forward. We try to make it fun. We try to do some physical activity during each of our groups. I use the Alice Walker quote about, when things are hard, when there's adversity, we all need to dance furiously. So we, have music and we dance, and we get 4 minutes of physical activity, and then we end each of our sessions with a loving kindness meditation, because what we know is that we have to be kind to ourselves as well as each other. And sometimes we are our harshest critics.
Mm-hmm. Yes, so true. That makes me wish I had a DPP program to be a part of. I mean, that's wonderful. Like at the beginning, because when you tackle things at the beginning, it makes it easier in the long run. Easier on your body, easier on your mind, everything.
Yeah, it really is physical health and mental health. Serena, you can join my group you're in Houston. We're in Philadelphia. You can join virtually. We'd love to have you.
Oh yeah, sure. Let me know when it is. I'll come and join.
So Marcy, from what you described, it sounds like the group was kind of like down to like that 8 core members when you went virtual. But do you think that COVID played a role in at all in like who stuck with the program or not? And what are your observations about what did make it like? Were there any patterns and kind of people who were able to stick with it? Did they have more support? Were they more committed? Or any observations around the group that kind of successfully completes it versus the group that doesn't?
There were some people who, and there are some people who have struggled since we've been doing the group remotely. And there is less engagement on the part of several people. I would say that there are 4 to 5 really committed people who have not permitted the going virtual transition to impact their attendance. Richard and one other participant have never missed a class. So he says 16 weeks, but he's just talking about the initial phase 1. Since then, we meet twice a month, and our first virtual session was the first Tuesday in April, and we've done it twice a month since then. And so that it has impacted one person's ability to really to engage with the computer. And one additional thing we did for folks was purchase tablets for everybody that's in the group. And so we tried to address that issue as well. And I also want to make sure that I mention, so that not only are we trying to address some of the social determinants of health that may impact engagement and success, but we also have to recognize the structural determinants of health and how racism and other isms have impacted, particularly right now, people's health and how people's health and the health disparities that we see very clearly, particularly with this disease, with this condition.
Yeah, absolutely, Marcy. I think it's important to acknowledge the role there. And also, as you were describing the way you end all of your sessions with kind of that loving kindness meditation, clearly you're very attentive to the mental health and well-being and stress levels of your participants as well, which I think is so critical. So Richard, could you tell us a little bit about how the switch to virtual was for you and how you made that work? Like, I think we know that your extraordinary tenacity is a real strength that has carried you through, but anything else that really allowed you to make that transition successfully and never miss a session?
Well, my background in the insurance industry gave me the IT, the information and technology with the computer, and I have a desktop here. And thanks to the G People program, I have a tablet. Thank you, Marcy. And and I have an iPhone. So being at my age, it was difficult for all three. I didn't have too much difficulty getting involved with it, with the technology, so that helped. The COVID-19 quarantine put a damper on us because, as I spoke with Marcy, the polar bears taking enough food to create enough fat to last them through the winter. Well, with the quarantine, we were just snacking and eating and storing all that stuff. So we had to integrate some exercise, indoor exercise, to offset that additional consumption. But that was a major challenge. After that, the group survived with the tablets. We signed on. We had some little technical difficulties at the beginning, but everyone signed on, and we resumed our natural positions.
Mm-hmm. And do you think that you'll keep in touch with that group beyond the DPP, Richard?
Oh, there's no doubt. There's no doubt.
Right. Great. That's great. And Serena, I want to hear from you and ask you, I'm sure that, you've been hearing, and I think you've discussed it, on this program before, but I think, you've seen some of the same challenges in the peer support groups, right? Around snacking and eating and being inside all the time and quarantine. So, anything that you want to add there?
Yeah, it's just a matter of behavior, if you're bored, you eat, not everybody, deals with boredom that way, but I know I used to deal with boredom that way. It's like, I'm bored, let me think of something to go eat, So being quarantined and everything, it's like you gotta really, that's when your willpower comes in, because you're right next to your refrigerator. Basically, all you have to do is take a couple of steps and walk over to the refrigerator and get what you want to eat. And if you're by yourself, nobody's watching you, right? So you don't have nobody looking over your shoulder like, what are you eating there? Put that back. You're left to yourself. So that's where the willpower comes in to say, okay, I got to stick to what I said I was going to do, and I'm going to do that. But that's an everyday thing, that's an everyday thing. So like, I really applaud Richard on, even, I heard you said your A1C now is 5.7. Whew, that's good. That is awesome. That is awesome. I'm still working mine down. I've gotten below 6, but not at 5.7 yet. So I'm working on mine. But yeah, the snacking thing is everybody's been talking about in peer support. They're like, oh, it's just so easy to just go grab a cookie, or, some days I don't feel like cooking, so I'm not gonna, it's a whatever you want to do type situation. So yeah.
Yeah. So Marcy, I want to go back to something that you started to bring up around, the social determinants and the structural determinants around health. We know that making and sustaining lifestyle changes is really hard, even in the best of circumstances. And Richard, you said, these are patterns and habits that we've all had for our entire lives, for decades, and it's really hard to break out of. And so Marcy, would love to hear how your team is trying to address some of those challenges around the social determinants of health and structural determinants of health that patients are encountering when they enroll in DPP and stick with it.
Well, we're just trying to maintain awareness about all of the, kind of the disproportionate numbers of people who are being impacted by this disease and trying to prevent it. I know that my goal, and I share this with my group often, is that not one additional person gets diagnosed with diabetes. And that so I have a great passion for that. I myself, I'm a type 1 diabetic. I've had diabetes since 1969, and I know of the devastation of this disease. So my goal is to really help people tap into their why, and really look at and do whatever needs to be done with their particular situation to address some of those determinants. Excuse me. So if there are some challenges, what do we need to do to address those? Sometimes there can be mental health challenges. There is a lot of, because of some of the comorbidities, there can be lots of depression and anxiety around this condition, with what's going on with systemic racism in our country, and its kind of failure to reckon with it. That can, this kind of trauma that people carry in their bodies and stress can impact their ability to take care of themselves. And so we are really looking at addressing, to me, I think one of the major concerns is learning how to manage one's stress, because stress is going to be there. And it's about how do we learn to cope with it, and not, as Serena said, go snack and go to the refrigerator or go to the cabinet. And, how do we learn some skills to take care of ourselves? How do we practice self-care? And one of the things I say to the group is self-care is not selfish, right? Self-care, right? Self-care is, as Audre Lorde said, is an act of political warfare. Like, that's how important it is. And so we need to learn and learn those skills. And sometimes it's, and that's one of the reasons why DPP, I think, is so effective, is because it builds in some of the evidence-based approaches that are effective in lifestyle change. DPP is not a weight loss program. It's not looking to have you lose 100 pounds or 80 pounds or whatever. It is looking at how do you make some changes to raise and improve your quality of life, and you improve your well-being, and managing managing our stress is critical, because stress is what makes us sick. Right. It's that cortisol that our bodies produce in crisis that's helpful in crisis, but that's dangerous if it's coursing through your body all of the time.
Right. Right.
I have one other thing that I'm using with the group that Richard may want to share something about, but it's through the GiveFit program in Baltimore. We use their personalized text messages or the system that allows us to give personalized text messages daily to everybody in the group. And I have found that, I think, because I send them to myself as well, just so I can receive them and so I see how it works. We just started using it several months ago. But what I found is that it helps engagement, and it helps success when you get a message that's consistent with the DPP curriculum. So it's maintains fidelity to the curriculum, but it helps the relationships, and it helps to engage people. And the GiveFit program also allows the participants to track their physical activity minutes, and also to track their food by taking a picture of the plate of food that they eat. So that's another kind of supplemental aspect to our DPP program.
That's great. Yeah, Richard, how do those text messages help you when you get them in the morning or during the day?
Oh, absolutely. I gave Marcy a new title, and that was the health ambassador. She would send every morning, 9:01 exactly, every morning, a text messages telling us what's going on, how to approach your day, and strategies of preventing the disease. I gave her another title that was Big Sister, because she would always watch our keep a tabulation on our tab on our exercise, the number of minutes we do every day, and the foods we eat. But she didn't like that title, so I told her I wouldn't call her that anymore, Big Sister, but she does have a watch over us all, and we appreciate that. In fact, the engagement for the each of us with the texting and the part of communicating since the quarantine and the COVID-19 put a damper on a lot. But the texting and the causes the camaraderie to continue.
That's great. Yeah. So I want to move into, how people can support friends or family members who might have been recently diagnosed with prediabetes and maybe are considering enrolling in a DPP program. So Richard, what would you tell like one of your friends who's like, hey, I just got my A1C's high. My doctor recommended this program to me. Should I sign up for it? Like, what would you tell them to get them motivated and get them engaged?
Well, I would first tell them of a tragedy first, where a particular individual ignored the doctor's advice, and they wound up with the legs amputated and blindness. And I would also follow up with having a proactive role in your health. Trust the medical science. Trust your doctors. Follow your doctor's advice. Want to live longer. Want to live a healthier life. And the DPP program, if you're not diagnosed as pre-diabetic, it's a good program to join. I mean, what else is that's been given to us? I don't see any other program offered me until this program came about.
Mm-hmm. Yeah, Marcy, do you have anything to add?
I just think it's important to pay attention to those signs and symptoms that maybe even if the person is not aware of, maybe somebody who's in their family or friend may notice or may pick up on, saying something like, you know what, you seem really, really tired lately. Mm-hmm. Or every time I talk to you, you're just complaining about, you've been seeing blurry. Or, you know what, we've been out to eat and you've every time, you pass the bathroom, you can't stop, you stop and make a visit there. So I think that it's important. It's almost like a call to action when you get this. And it's to me, it's like a gift. If you get told that you are pre-diabetic, then you can make these small changes and participate in a program like DPP, which can give you the opportunity to change the direction and improve your health and well-being, and hopefully eliminate some of the devastating effects, as Richard described some of them, the devastating effects that this disease can have. I think that lifestyle change is really difficult, and that we have to remember that change happens and change occurs in the context of relationships. And I think this is one of the reasons why the DPP is so effective, because it's the relationships, whether it's the coach and the group or the group together, or really everybody's relationship with each other, and the support that everybody gives to one another, creates the success and the desire for success. And I think what we're going to do is develop a Facebook group for our DPP group so that they are able to stay engaged and supportive of one another. Most of them live in the same area, and will be able and have formed a relationship over the course of this year that they did not have. We were all strangers on September 24th, 2019, when we started this. We were all strangers, and now we know so much about each other and care about each other. And that's how we can change. When you feel cared about, you can respond and you can change.
Mm-hmm. Yeah. Mm-hmm. And I think, it's so important what Marcy and Richard mentioned. I picked out one key thing I heard, which was let people know what the devastating effects of diabetes is, because the tragedy of it all is that people hear the term prediabetes and they're like, oh, I'm okay. I feel okay. It's going to be okay. People live a long time with diabetes, but, they do that without caring for what's going on in their bodies. And honestly, in peer support, I use that. I use the devastating effects because I myself have gone through some complications of diabetes. And I'm like, you all do not want to go through this. Like, take care of your bodies now, because you don't have to experience the complications if you take action right now. And I think that is very effective when dealing with people who have been diagnosed with prediabetes or diabetes or gestational. You tell people, look, this is what's going to happen, and tell them something different than, you always hear oh, you're going to get a leg or a foot cut off, right? That's the main one everybody goes to, right, is amputations. But diabetes affects your body from head to toe. So there are other complications, other things that your body can go through as a result of diabetes. And it's important to know that. It's all diabetes education,
Yeah, I love, this idea that everybody's coming back to. I think it's a balance, right? Is that you want to be real with people about what the risks really are and what can happen to them. And that can be very motivating in making some of these really hard changes. But you also want to frame a diagnosis like prediabetes as an opportunity to make changes, and not as something that is shameful or something that carries stigma or something that's going to kind of make someone want to go and hide from it, when it really should make them take action and confront it head on. And I think that that's one of the things that the DPP program can really help with, is that you're talking about this in a group setting. You're normalizing it, you're all having that same experience, and you're able to just talk through it and kind of find that motivation and that opportunity and that empowerment in that moment. So,
right.
Yeah.
I mean, great. I think it's also really important to tell people that type 2 diabetes is preventable.
Mm-hmm.
And I think a lot of times healthcare providers may focus on the diabetic patients and don't necessarily put as much effort and time into the patients before they develop the diabetes. Right. And I understand why, because there's so many diabetic patients and there's so much work to do. But I think if we really look at prevention, then we can really address this public health epidemic, in ways that we haven't been able to, and not only in this country, but across the world.
Mm-hmm. Definitely. Mm-hmm. Yeah, for sure.
Yeah, and I want to emphasize too, we talked a little bit about, how it can be hard for people to stick with this program. We talk all the time about how these lifestyle changes are really hard, and we really want to celebrate every little thing that anyone's doing to take care of themselves. And so I just want to emphasize again, the DPP, I think, is a fantastic tool. It works really well for a lot of people. But if you have prediabetes and then you find out later that you have developed type 2 diabetes, I just want to emphasize that that's also not a failing, right? And that's not something to be ashamed of. And every day is a new day that you can pick up and think about, the actions that you want to take and the lifestyle changes that you want to make to help manage that better.
So. Right. I'll tell y'all right now, I've been type 2 for 17 years, and it's been a lot of ups and downs. It's never too late to get started. it's never too late. I really just start getting really serious about this. Well, a few times in my life, but you know, life happens. But I really started getting serious about this 3 years ago, when I started having problems with my liver and my kidneys, and I went completely blind last year. And you know, after those things happen, it's like, whoa, it's like you don't want to get to that point.
Right.
But for me, it was like, whoa, okay, I gotta do this. And I'm actually seeing the results of my 3-year journey. It definitely is, like Marcy said, it should be a lifestyle change and not just a diet or something I'm just doing for right now. Okay, I got my numbers down so I can go back. No, don't go back, because then your body's gonna go back to the state it was before. You know, so you can start at any point in your life. It's never too late. Never too late.
Mm-hmm. Thanks. Yeah, and Richard, I want to ask you, kind of throughout your involvement with the DPP program, you know, you've talked a lot about the different lifestyle changes that you've made related to nutrition, physical activity, the way that you've adapted, having to be indoors more. You know, what's been most rewarding for you as you've participated in this program, and what changes have you seen, you know, in your health and in your mindset?
Bigger smile. A bigger smile. Marcy is the actual, I give her more credit than she gives herself. She's the glue of our program. And what I mean by glue, adhesive, she keeps it together, and to want to make that change. All my life, I've taken a proactive role in my health. I've never given that up. Just by age, you acquire different problems, which is normal. And I seek out my medical professions to help me continue with my life. I can only help people if I'm still here. So concentrating on that fact, I have to take care of myself in order to take care of someone else or help someone else. And taking care of myself, along with the 5 ingredients of my daily ingredients. Number 1 is home. Well, it doesn't necessarily have to be the physical house, but it could be Philadelphia, it could be United States, it could be America, it could be your community or neighborhood. But home comes first, health is second, finance, take care of your finances, so you'll be able to contribute to your health, your home, your family, and to your community. Manage your time, which is so important.
Yes.
And prayer.
Yes.
That's great.
Yeah.
Thanks. Yeah, so Marcy, do you have any kind of like final words of wisdom? I see we're probably going to start wrapping up in a few minutes, but any words of wisdom for DPP participants or for people who are considering enrolling in the DPP? What would you tell them?
Well, I just wanted to say, and I've said to Richard, he knows that I'm the guide on the side, and that it's the DPP participants that are doing the work. They are doing the work, and this is hard work. And as Serena said, you know, it's very worthwhile work, but it doesn't mean that it's easy to do. But I think that we change when we have a reason to change, when we're ready to change, or when something in our life, in our lives, requires us to change. And I think that we have to be very self-aware. And in order to manage a disease or the borderline diabetes, the pre-diabetes, any kind of chronic condition, we need to be self-aware. And we need to make a commitment, and that anything that's worthwhile requires a commitment. And it's a commitment to make a year-long effort to change. but it will be a commitment that will be so transformative for one's physical health and one's mental health. And I've seen it work both in the group that I facilitated last year and now in this current group that's getting ready to end. I have seen it work, and I've seen people's lives change, and I've seen people's A1Cs go down to not pre-diabetic range, their triglyceride levels drop, their cholesterol levels drop, and their blood pressure levels drop. So we know this is effective, we know it works, and please take heed. As Serena said, it's never too late.
Mm-hmm. Yeah, thanks, Marcy. And I think I want to also comment something, Richard, you've mentioned a couple times, is that you also work with your specialist, you're working with your physician, you're working with your whole support team to figure out what's right for you. And obviously, that's always what we encourage everyone to do, is to really think about and talk about their specific situation, with their care team, their physicians, their specialists, to figure out what's right for them and what's going to work for them, and really what they need to stay healthy. So Marcy and Richard, what are you going to do this week to celebrate that, you have your last class on Tuesday? How are you going to celebrate?
Well, we have a virtual graduation ceremony planned. Mm-hmm. And so I don't want to give away too much, because Richard hasn't participated in it yet. So, but we have a virtual graduation ceremony planned, which will even include pomp and circumstance, and I'm just hoping that I can avoid any tears. I'll just put it that way.
I don't know. I'm getting emotional just thinking about it, Marcy. I don't know if that's going to be possible. So,
I know.
Richard, how are you going to celebrate?
Well, I'm just happy that Serena hung in there. I think the world needs her smile, and we'll celebrate with everyone included in the program. That on our final days, Marcy always reminds us every day, there's 4 days left, there's 3 days left, there's 2 days left. But we're going to celebrate in all honors, and appreciate the DPP program that it has helped us stay alive.
Mm-hmm. That's great. And Serena, how are you going to celebrate small victories this week?
I'm gonna take a break. Sit down and be quiet and say nothing and stare into space. Break, even if it lasts for 30 minutes. That's what I'm gonna do.
I mean, I think that is as good a method of self-care as anything, right? Again, coming back to this message, Marcy, you put it well. Self-care is not selfish. Whatever you need to do to take care of yourself, it's important to take the time to do that. So, in our last minute, just want to ask all three of you, any final thoughts, on kind of prediabetes, DPP, motivation, anything you want to share with our audience today?
I would say share all of your, how do I say this? Celebrate every small success, because just because it's not as big as someone else's, your A1C might not have gone down, but you drank 3 more bottles of water this week than you normally would. Celebrate that, even if it's just, yay, I drank more water, because those small ones will turn into big ones. When you learn how to celebrate the small ones, it won't be like you're never satisfied. It's like, oh yeah, all I did was lose 5 pounds. That's it. It's like, no, that's big, especially when it comes to your numbers when you're dealing with diabetes, blood pressure, cholesterol, all of those numbers. Those are important. Celebrate the small successes. It's going to help you out.
And I would say that this is about our physical health, our mental health, and our spiritual health. So connect to something bigger than you, and that's each other, and and do some of the things like practicing gratitude, and being kind, and celebrating positivity and incorporating positivity into one's life, so that we are as resilient as possible, and so that we can reduce or manage the stress in the best way possible, so that we can stay alive, and while we're alive, stay healthy.
Yes. Yes.
That's great.
Well, my last statement is discipline determines your destination, not your desire. And I mean by that, that procrastination should be classified as a disease. Concentrate on what you want to do and go about doing it.
Yeah. That's a fantastic note to end on for today's session. So it's been a wonderful start to our Saturday morning with yet another great panel of guest speakers. And to our viewers, we hope that this conversation has made you think about prediabetes and the actions that you can take, to take care of yourself, and reach out and get help and find the support that you need. And we just want to say thank you for joining us this morning. So mark your calendars for next week. We'll be broadcasting every single Saturday, 10 a.m. Central Time, 11 a.m. Eastern Time. Our next episode will air next Saturday, September 26th. Thanks, and we hope to see you next week.